Hi, I'm Chongjiao from Zhongnai Hospital, Wuhan University. Thanks for joining us. In this video, I'll share our recent article in HER entitled Utility of Volumetric Metabolic Parameters on Preoperative FDG PET CT for Predicting Tumor Lymphovascular Invasion in Non-Small Cell Lung Cancer. Lung cancer is one of the primary causes of cancer-related mortality. NSCLC is the most common pathologic subtype. Multiple clinicopathologic variables are associated with a worse prognosis in NSCLC, including tumor stage, tumor differentiation, visceral involvement, lymphovascular invasion, and so on. LVI is an adverse prognostic indicator for post-operative adjuvant chemotherapy recommendation after resection. FDG PET CT is widely used for the staging, treatment response evaluation, and prognostic prediction of lung cancer. SUV max is the most commonly used semi-quantitative parameter, but it represents the volume of only a single box of glucose metabolism in the tumor. The volumetric parameters of MTV and TLG are recognized as more reliable indicators of overall tumor burden. Therefore, the purpose of this study was to assess the utility of clinical pathologic factors and volumetric metabolic parameters from preoperative FDG PET CT in predicting primary tumor LVI in SCLC. The process of patient selection was shown in this slide. A total of 230 consecutive patients with NSCLC who underwent FDG PET CT before surgery from January 2018 to November 2020 were initially identified. 69 patients were excluded. Finally, 161 patients were included in this study. Clinical pathologic information was extracted from the electronic medical record, including patient age, sex, smoking status, histologic type, visceral invasion, LVI, tumor T category, N category, TNM stage, and serum tumor markers. For the FDG PET CT and image analysis, 2 nuclear medicine physicians independently reviewed PET CT images. The first reader manually placed an outline around the general location of the pulmonary tumor according to PET or fused PET CT images. Then workstation automatically generates a VOI around the tumor, encompassing the entire tumor metabolic activity within the initially placed outline. SUV max was recorded as the largest value and SUV min as the mean value within the VOI. MTV was recorded as the total volume of all pixels within the VOI above an SUV threshold of 2.5. TLG was then calculated as the product of MTV and SUV mean. This slide showed an example of the VOI delineation. The detailed statistical analysis was shown in this slide. Table 1 summarizes the clinical pathologic features. A total of 118 tumors were had carcinoma, and 38 were squamous cell carcinoma, and a total of 38 patients had LVI. The two observers showed perfect concordance for the SUV max with an interclass correlation coefficient of 1.80. The other measured metabolic parameters also showed excellent observer agreement with an RCC of 0.97 for SUV mean and 0.99 for MTV. Several clinical pathologic features were higher in patients with LVI, including median tumor size, the median CA, SUV max and in the primary tumor, median MTV, and TLG. LVI was not associated with patient sex, age, smoking history, histologic subtype, tumor location, visceral pleural invasion, or the other serum tumor markers. Next three shows the comparison of tumor FDG activity between patients with and without LVI. Each dot or triangle represents a single patient. Table 3 summarizes the diagnostic performance of the metabolic parameters separately. Table 4 presents the results of the multivariable logistic regression analysis to identify independent indicators of LVI, including M2A and lymph node metastasis. Among individual T categories, T2 was an independent indication of LVI using T1 as a reference. The other clinicopathologic factors and metabolic parameters were not independently associated with LVI. At ROC analysis, the predicted probability of LVI according to the combination of MTVA, N category, and T2 exhibit an AUC of 0.854. In conclusion, the volumetric parameter MTVA on preoperative FDG PET is an independent predictor of tumor LVI in resectable NSCLC. Among a range of clinical pathologic characteristics, pathologic regionally lymph node involvement was also an independent predictor of LVI. Further investigation was warranted regarding to the applications of this association to guide patient management in SCLC. Thank you for your time and attention. Hope you enjoyed the article published in AJR.